Hi everybody, Dr. Bryton here for Two Tip Tuesday. Today we're going to be talking about teething. So we get a lot of patients in here that are young, and we get a lot of parents in here that have young children. And as some of you probably are aware of, they go through a period of time when those baby teeth are coming in that can be really uncomfortable and sore and painful for the child. First tooth usually comes in around 6 months, give or take, and it can be a couple of years before they're done getting all those baby teeth. And every time they get a baby tooth, it can be quite uncomfortable. And so with that, we get a lot of questions saying, how can we better take care of them, make them feel a lot better? So first things first, I recommend acetaminophen or kids Tylenol. When they're old enough, kids Motrin or ibuprofen can be even more beneficial, but both those are really good. The reason why we go to kids Motrin has an anti-inflammatory side to it. A lot of the pain that kids experience comes from swelling as the tooth comes through the gums, and that creates pressure. Pressure creates pain. So if you give kids Motrin, we can take care of some of that swelling so they don't get as much pressure and pain, and then we can also take care of the pain itself. And so kids Motrin is a great way to go. From there, teething toys can be really, really helpful. Rubber is ideal. So you get a harder object, it can actually hurt the gums a little bit, but quite frankly, there's somewhat of a line there that you can kind of guard against, because some of the frozen items that you can repeatedly freeze, give to the child, the teething toys, can be really nice because they're cold and they're helpful, but you need to be careful that the child isn't actually hurting themselves with one of those frozen items. So monitor that while they use it, but if you can use a frozen one, that's great for the area. It's going to make it feel a lot better, but just make sure that they're not hurting themselves with it, and make sure they're actually getting some comfort out of it. So some teething toys can be really, really helpful. They come in all different sizes and shapes. You can get stars, you can get hearts, you can get all kinds of things. They even have pacifiers, or pacifier-looking objects that you can use as well. You can get them at Target, Amazon. They can all be really helpful. So hopefully those things are helpful for you. One thing that I really do want to make sure that I note, though, is I do not recommend any kind of teething jewelry. It can come in the shape of a bracelet, a necklace. There's all kinds of different things. But the American Academy of Pediatrics released in their news report in February 2019 that they are unsafe. I would stand by that as well. The FDA has stated they're unsafe. Unfortunately, the FDA even reported that an 18-month-old was strangled by one of the necklaces. But in addition to that too, they have beads to them, many of them do, that can come loose, and so there's incidents of choking on those, or choking hazard. So I do not recommend any kind of teething jewelry, and I want to make sure I'm clear on that. So hopefully that's helpful for you. If you have any questions, please reach out to us. You can call us, comment below, so we can help out the group that's paying attention and looking for some Q&A. We appreciate you tuning in. If you like it, like it. If you think it can help somebody, please share it. We appreciate you tuning in. So have a great rest of your week. Thank you so much.